Hi all, very good evening team. Today we are going to have a small demo session on IPDRG training. Welcome all to the AGS Coding Tech. So team, we are having our branches in both Chennai and Hyderabad, and we are providing both online and offline sessions. So whichever is convenient, you can make use of that. Okay, so let us move on to the demo. So coming to this IPDRG training. So this IPDRG training can be taken by both experienced as well as freshers. So based on that, we will plan the syllabus. So if you are an experienced candidate, like if you have already worked in any other facility, like if you have already worked as a medical coder, either in HCC or any other facility, then we will plan the syllabus accordingly. Whereas if you are a fresher, like if you are new to medical coding, like you know nothing about medical coding means, then based on that we will plan the syllabus. So this course is suitable for both the freshers as well as experienced candidates. Okay, so next coming to the syllabus covered in this IPDRG training. So first I'll explain this IPDRG, that is IP, Inpatient Diagnosis Related Group. So the name itself says as inpatient. So this type of coding we will use only for the inpatient admission. So only if the patient is admitted as an inpatient, then only we will use this particular type of coding. Next thing is coming to the books which is used for this IPDRG coding. So the first book which we use for coding is ICD-10 CM. For coding diagnosis, we will be using ICD-10 CM. Okay, so if you're a fresher means you'll not be aware of this. So let me explain this medical coding first. Medical coding is nothing but conversion of patient data into universally accepted alphanumeric codes. Let me simplify this. Assume that you are given with a patient case sheet. In medical coding, you are going to have a patient case sheet, a patient's medical record they will provide you. So from that medical record, so medical record means it will be some 10 to 15 pages, it will be minimum, right? So in that, the needed information only you are going to gather from the medical record, which is diagnosis. That is why the patient is coming to the hospital and why he is getting admitted today. This is what diagnosis is. So we need to take alphanumeric codes from universally accepted code books. From that code books, we need to report this codes. Say for example, if patient is admitted for myocardial infarction, which is heart attack. So patient is admitted for myocardial infarction. So what we have to do is we have to make use of the ICD-10 CM book. You can note down ICD, International Classification of Disease. So ICD-10 CM book will be used for diagnosis coding. So for myocardial infarction, there will be a code. So that code we need to report. And additionally, if patient is having any other conditions along with this myocardial infarction, like patient is already diabetic, hypertensive, like that means, then for that also we need to report the codes. So the first manual which we use for disease coding is ICD-10 CM. And next, coming to the ICD-10 PCS manual, which will be used for procedure coding. So diagnosis, we will be reporting from the ICD-10 CM book. That is ICD-10 CM means clinical modification. So this ICD-10 CM book will be used for diagnosis coding. Once you have coded the diagnosis means, Then the procedure performed. So if they have performed any procedure to that patient, that procedure code we need to take from the ICD-10 PCS book. PCS, which means ICD-10 Procedure Coding System. So PCS refers to Procedure Coding System. So procedures we will be coding from the PCS book. Procedure means like a patient is admitted for myocardial infarction, right? So for this, like they have done angioplasty and stent placement, or if they have performed any coronary artery bypass grafts for that patient, then these are the procedures which we will code from the PCS book. So these are the manuals which we are going to use for coding. So for diagnosis coding, ICD-10 CM book. For procedure coding, we are going to use ICD-10 PCS book. Okay. Next, coming to the payment methodology. Uh, we will be taking all the diagnosis related to that patient, like all the other conditions. So the first code will be known as principal diagnosis. The first code which you are picking for the patient. The first diagnosis code which you are picking for the patient is known as principal diagnosis code. Principal diagnosis means nothing but the condition which is responsible for the patient's hospital admission. So that is the principal diagnosis. Why the patient is getting admitted to the hospital today. So that disease is going to be the principal diagnosis. That it can be a disease, well-defined disease, or it can be a sign or symptom. So that is going to be your principal diagnosis. So in case if there is no well-defined diagnosis means, then we will code the signs and symptoms also. Sometimes if the diagnosis is not clear means. Okay. So after that, the other conditions which the patient is having, so they will be coded as secondary diagnosis code. As I have said, this diabetes, hypertension, like that. Or patient previously experienced myocardial infarction, previous history of stroke, family history of cancer, or if patient is using any drugs for a long time, that is a long-term use of insulin, long-term use of anticoagulants. For all this, we need to report the codes. So all the codes related to that patient, we need to report from the ICD-10 CM book. And then all the procedures performed in the hospital setup should be reported under the procedures. That is, we will use PCS book to report all the procedures. So coming to the payment methodology, in case of outpatient payment, like those who have worked in outpatient payment may be aware of this. So you will be taking ICD and the corresponding CPT code you will be reporting. So for each CPT code, there will be a bill amount. Finally, they will add all this bill amount. Say for example, if they are picking 4 procedure codes using CPT book means, so that all the amount, like for 4 procedures, there will be separate amount that will be added to get the total bill amount. So this is how the outpatient payment methodology works. Whereas coming to this IPDRG payment, it's not like that. So you have taken all the ICD codes, that is all the diagnosis codes you have coded, and all the procedure codes you have coded. So with this, a 3-digit number will be selected, which is known as DRG, Diagnosis Related Group. A 3-digit number will be selected based on the diagnosis and based on the procedure coded. Like you have coded the diagnosis and the procedure, right? So based on this, a 3-digit number will be selected. This is known as DRG. So based on this 3-digit number only, payment will be provided. So DRG 547 means there will be a bill amount. DRG 680 means there will be a bill amount. So based on that only payment will be decided. For each inpatient admission, patient will get only one DRG. Despite the number of days the patient is spending in the hospital and despite the number of conditions which patient is experiencing, despite the number of procedures performed, there will be only one DRG allocated to each patient for each inpatient admission. Say, for example, today I'm getting admitted to the hospital and I'm going to be in the hospital for 10 days. So for this total 10 days, it can be 10 days, 20 days, or even 3 days, 4 days, whatever it may be, and whatever may be the conditions which I'm suffering or the procedures performed. We are going to select only one 3-digit number. So based on that 3-digit number only, payment is going to be provided. So this is what DRG method of payment is. So in DRG, we are having different types of DRG, MS DRG, APR DRG, IPR DRG. These are the types of DRG team. So these things will be discussed in detail in your session. The types of DRGs and how the DRG impacts the payment. As I said, so one DRG will fetch you only reduced payment, whereas another DRG will fetch you higher payment. So we are going to discuss all those things in the session, like which DRG will fetch highest, which DRG will fetch you the lowest payment, and why this happens and all. So these things will be discussed in your session. Types of what does mean by DRG, the types of DRG and its impact on payment, everything. And then there will be assessment for the basic medical coding knowledge. Assessment means we'll be providing you questions. So you need to take those tests. Okay, so basic medical coding knowledge means nothing but basic anatomy, like each body system anatomy, physiology. Anatomy means what are all the organs involved in that particular organ system and where it is located. These things are the anatomy. Say, for example, if you take cardiovascular system, so cardiovascular system means it is going to deal with heart and blood vessels. Okay, so anatomy means where the heart is located and what is the structure of heart. These things and all comes under anatomy. Next, coming to the physiology. So how the heart is functioning, how it is pumping blood, these things and all comes under physiology. That is functioning of a body system. And next, coming to pathology. Pathology means disease condition related to that body system. So for example, I have told you this cardiovascular system. So diseases related to cardiovascular system. So diseases means this thing, heart attack is related to cardiovascular system, hypertension, that is high blood pressure, all these are related to cardiovascular system. So these things. And next is the treatment. So we are going to discuss anatomy, that is the assessments will be in the anatomy, physiology, pathology, and the treatment part, and from the medical terminology. So medical terminology means nothing but in common man terms, we will say it as high blood pressure, but medically we call it as hypertension. Similarly, we will call heart attack. In layman terms, we will say it as heart attack, but medically we call it as myocardial infarction. In layman terms, we will say it as patient is suffering from sugar, but in medically we call it as diabetes mellitus. So from this medical terms also, you will be having assessment. So once you have done with the assessment, then we will discuss how to code the principal diagnosis, like how to make use of the ICD book and take the principal diagnosis. Then we will discuss about the UHDDS guidelines. So there is a set of guidelines which we need to follow, because if you are taking one principal diagnosis, but from my perspective, if I'm taking another diagnosis, now it will not be good. So universally, there is a set of guidelines which we need to follow, which we call it as UHDDS guidelines. So these guidelines will be discussed. And next, coming to POA indicator. Let me explain this POA indicator. So POA indicator means nothing but present on admission indicator. You can note down present on admission indicator. Let me explain this. So present on admission indicators will say whether a disease is present before the hospital admission itself or the patient developed only after hospital admission. That we can able to know with the help of POA indicator. So we coders need to assign this POA indicator team with the help of the case sheet, as you are going to have the patient's medical record. So you need to read the record carefully and abstract the information. Say for example, as I said, like I'm going to be admitted to, okay, so I'm getting admitted to the hospital because of myocardial infarction. Okay, so now the thing is, you need to identify whether I have developed this myocardial infarction before hospital admission itself, like I have developed or else after getting admitted. Say for example, okay, I have okay, I'm admitted to the hospital because of myocardial infarction and and I'm taking treatment in the hospital. Still I'm in the hospital only, but in the hospital, I have developed so many conditions. Like I have developed infection and I have got fracture in the hospital itself because of slipping in the wet floor. I have got fracture. So these things are not present during my admission. Only after getting admitted to the hospital only I have developed these conditions, infection, fracture and all. Then in this case, we can able to know that the quality of care provided in that hospital is very, very poor, because I am getting admitted because of one problem, but after getting admitted to that hospital, I'm developing a lot of problems. So this POA indicators will help us to know about the quality of care provided in the hospital. Because we are going to assign, right? Like as a medical coder, we are going to say which conditions are present before admission and which are developed after admission. That we are going to decide based on the medical record. So based on the documentation, we are going to decide. So this is the use of POA indicator. Next, coming to CC, MCC, and hack conditions. So I have said, right, like the principal diagnosis is the very first code which you are writing for the patient, which is responsible for the patient's hospital admission. And the other conditions which the patient is having, right? So if that is a major condition means then it will come under major complication or comorbidity, or it will come under complication or comorbidity. See, a patient is getting admitted to the hospital for a condition. So I'll give you one example. Two patients are getting admitted. Patient A, patient B is getting admitted to the same hospital for the same reason. Same hospital, same reason patient is getting admitted to the hospital. Say for example, why the patient is getting a fracture. So both patients are having a traumatic femoral fracture. So they have got fracture. So because of this fracture, they are getting admitted to the hospital. Both patient A and patient B. See, consider that patient A is a normal healthy patient. Whereas if you take patient B, patient is hypertensive. Patient is having diabetes. And patient is having COPD. So the patient B is having diabetes, hypertension, COPD, whereas patient A is a normal healthy patient. So anyway, for both of the patients, we are going to provide the same treatment, but the physician needs to be careful regarding the patient B, because he need to make some changes to the medications. So whatever treatment they are planning, they need to be extra conscious for the patient B, because he's already having some other conditions. So the patient B will use more resources than the patient A. That is, it can be material resource or it can be human resource. Like they need to give some extra medications to the patient B, or they need to take extra care of the patient B than the patient A. So the patient B is more resource intensive than the patient A, right? So we need to give extra payment to the patient B. The doctor who is treating the patient B should get some extra payment, right? Because he is treating a patient with other conditions. So that we can able to know with the help of CZ, MCC and hack conditions only. So CZ and MCC I have explained. Coming to hack. Hack means nothing but hospital acquired condition. Again, with this hospital acquired condition, we can able to assess the quality of care provided to the patient in a particular hospital. So these things and all, we will discuss what does mean by CZ, MCC and hack conditions. So after completing all this, we will move on to the ICD-10 CM book. So in ICD-10 CM book, we'll be discussing we'll be giving the general intro, like how the book will look like and how to use this book. So conventions and general guidelines means how to use this ICD book. As you are new, if you are a fresher and you are not aware of medical coding means, then we need to explain, right, how to use this book and how to take the appropriate code, these things. Then each ICD chapter is having its own guidelines. Totally, there are 22 chapters in the ICD book, and each chapter will be having its own guidelines. So those guidelines will be discussed in detail, and you will be having the assessment for the same. Like if I have completed, if we are completing ICD chapter 1 and 2 guidelines means, then you will be having assessment on the same chapter 1 and 2 in the app. So you can either make use of the mobile app or you can use the desktop link also. So you can take your test either in the mobile, laptop or desktop. In anything you can take your assessment. So after completing all the ICD chapters, you will be having the appropriate assessment, that is question and answer, which you need to answer in the app. Then we will discuss about the clinical indicator. Okay, so coming to this clinical indicator, which is nothing but, as you are going to have the patient's case sheet, right? So for that case sheet, assume that they have mentioned patient is taking lisinopril. In the patient case sheet, in the history, they have mentioned patient is taking lisinopril. And BP reading, they have mentioned as 150/90 mmHg. So, so this is an example only I'm saying, like you are abstracting information from a patient case sheet. In that case sheet, they have mentioned as patient's blood pressure is 150/90 mmHg. And they have mentioned that patient is taking lisinopril. Like this, they have mentioned. But in the entire case sheet, nowhere they have mentioned that patient is having hypertension. But we know, right, the normal blood pressure reading is 120/80 only. Here they have mentioned as 150/90. And this lisinopril is an antihypertensive drug. So these are the clinical indicators present for the hypertension. With this, we can question the provider. We can question the physician. So questioning is known as querying. We can query the physician. Like you have mentioned that blood pressure is 150/90 and patient is on lisinopril. Can you please specify like that? You can ask like that. You can ask the provider, physician. Okay, so these are known as clinical indicators, that information they have, which is present, right, related to a specific disease condition. These are known as clinical indicators. With that clinical indicators only, we will raise a query. As I have said, query is a question. We will raise a question based on this clinical indicators only. So we will discuss the clinical indicators. What is the indicators for hypertension? What is the indicators for myocardial infarction? What is the indicator for respiratory failure? So these things will be discussed. So after completing all this, now we have completed the DRG and this ICD-10 CM chapters, everything we have completed. So now we will move on to the ICD-10 PCS book, procedure coding system. So once you are well versed with diagnosis coding means, then we will move on to the procedure coding system. So same like ICD-10 CM, we will explain like how to use this PCS book, how the codes are classified, and how to lead a code for a specific procedure. And in each system, important procedures will be discussed. So if you take a digestive system means, so gastric bypass, PEG tube insertion, NG tube placement, and ostomy procedures, tumor removal, like that. Procedures related to each body system will be discussed in detail. Say, for example, if you take cardiovascular system means, then in cardiovascular system, coronary artery bypass grafting or any valvuloplasty, valve replacement or repair work, angioplasty procedure. In this way, for each body system, important procedures will be discussed. And for the same, you guys will be having the assessment in the app. So after completing all this, you will be having the assessment. Then after completing all the corresponding ICD PCS assessments, then we will discuss parts of a IP record and how to read a document and how to read the history and physical examination, progress notes, these things. This is nothing but team. You are going to have a medical record, right? Like somewhat time, some 10 to 15 pages, or some case sheets will be 15 or 20 pages like that. So that the case sheet you are going to have, right? So how to read that case sheet? So those things we will discuss. And what are all the things present in a patient record? Like commonly, right, that the discharge summary will be there, history and physical examination part will be there, then progress notes. Then if there is, if they have done any consultation with the specialist, consultation reports will be there. Then if they have performed any surgery, operative report will be there. If patient is admitted from the emergency department, then emergency department report will be there. And if they have performed any imaging means, that imaging report will be there, that radiology report will be there. If we have performed any lab test means, then lab report will be there. So we will let you know like what are the parts of our IP record and how to read it. These things will be discussed. And then types of IP facilities. So types of IP facilities means we are having acute care hospitals, long-term care hospitals, skilled nursing facilities, critical access hospitals. So different types of hospitals. Like if you take hospitals in India also, we are having a lot of different types of hospitals, right? In rural areas, we'll be having primary health centers. In urban areas, we'll be having government hospitals like that we are having, right? Government side, I'm saying, whereas private hospitals also we are having. So in this way, we will be discussing what are the types of inpatient facilities. So those things will be discussed. Then coming to the pharmacology. So in pharmacology, we'll be discussing important drugs related to each disease. So hypertension means what are the common drugs? As I have said, I have given an example, right? Patient is on lisinopril. So you should know that this lisinopril is a antihypertensive agent. Then only you can query the physician. Patient is taking lisinopril. Coming to insulin. So if patient is taking insulin means, then you should know that patient is diabetic. Only diabetic patients will take insulin. So these things will be discussed in pharmacology. And if patient is taking beta blocker means, then there are high chances patient may have hypertension, like atenolol, propanolol, like that. So these things we should be aware of. So in pharmacology, we'll be discussing the important drugs and its uses. Next, types of physician queries. So as I have discussed that physician query means questioning the physician. So in that there are different types of query. Yes or no type query is there, verbal query, then so a lot of there is different types of queries are there. So we will discuss this types of queries and how to write a proper query. That is also very important. How to write a compliant proper query. So these things will be discussed. Next, so we have completed all this. Next, we will navigate through the 3M software, like how to use this 3M software. So those things will be explained, and we will discuss some sample charts, and we will take codes in the 3M software from the sample charts. And then we will discuss the medical billing and complaints. So complaints means nothing but uh, the set of rules which we need to follow, team. We are going to deal with patient's health information. So patient's protected health information we are using. His personal details, we are dealing with patient's personal information. So we have to be very careful with this. We should not disclose this information to others and all, right? So those rules will be discussed in medical billing and compliance, and how this medical billing how this RCM works, and what are the ethics which we need to follow as a medical coder, and what does mean by fraud, what does mean by abuse of a patient. So, and what are the laws which is against this fraud and abuse. These things will be discussed. And after that, there will be final mock uh, assessment. So you need to take the final mock paper and after completing that assessment, we will be having discussion on that. And we will discuss all the you will be having mock papers and final mock papers, test papers also you'll be having. So once you have completed all the assessments, we will plan discussion on each topic. Next, coming to the type of classes which we are offering, team. So we are offering both online and offline classes. So whichever is comfortable, you can make use of that. Either you can take offline or online session. And timings for this offline batches, that is total course duration, it will be 45 to 60 days. Okay, so it will be 45 days to 60 days. Either you can be a fresher or experienced candidate, so 45 to 60 days. And coming to the batch timings, see, I'm talking about the offline. So offline sessions will be Monday to Friday, 10 a.m. to 1 p.m. Whereas if you want to opt for weekend batch, sessions will be on Saturdays and Sundays alone from 10 a.m. to 3 p.m. Only on Saturdays and Sundays. Or else, like if you are not comfortable with offline, like you are residing in a remote area, you want to take offline, means well and good. We are offering offline online training also. So weekdays batch timings will be that is the course duration will be 30 to 45 days. Whereas if you are opting for weekend, means it will be 45 to 60 days. Because weekdays means you guys are going to have 5 days of session, whereas weekend means we can offer you only 2 days, right? So it will be 45 to 60 days in case of weekend, or weekdays means it will be 30 to 45 days. And coming to the class timings, Monday to Friday, it will be 8 p.m. to 10 p.m. If you are opting for weekdays batch, Monday to Friday, 8 to 10 p.m. will be the session timings. Whereas if you want to opt for weekend batch, means sessions will be on only Saturdays and Sundays, 5 p.m. to 8 p.m. So totally 30 classes will be there and 60 hours class duration. In that, 15 days live training and interview preparation will be there. Live sessions will be there. Okay. So next, I'll explain about this plans which we are having. We are having basic plan and premium plan team. So in case of basic plan, you are going to have the soft copy of ICD-10 CM book, ICD-10 PCS book, ICD-10 CPT book, CPT. Okay, because if you want to take your CCS exam means you should have all these books. That is, you should practice with all this because your CCS exam will test your knowledge in both outpatient and inpatient coding. Like if you want to know more about the CCS exam and if you want to prepare for CCS exam means, you can ask for the demo regarding CCS. Like we have offered a separate demo for the CCS exam pattern and the domains, everything we have discussed in detail in that. So let us come back to this basic plan. So you will be getting soft copy of ICD-10 CM book, PCS book, CPT book. And apart from that, this anatomy, physiology, and medical terminology book soft copy you will get. And the CCS study guide, you will get it as a soft copy. All this you will be getting as a soft copy. And you will be having the app access for 6 months. 6 months we are giving the app access where you can take all the assessments, and we are providing recorded sessions also team. Okay, so if you are not able to attend a session on a specific day due to some network issue or due to some personal issue, if you are not able to attend means, no need to worry about it because we are offering recorded sessions which no other institute is offering. So whenever you are whenever you are convenient, you can view this recorded session. So this recorded sessions will be available for 6 months in case of basic plan, and all the study materials you will have access, and for all the assessments you will have access for 6 months. Coming to the premium plan. So the advantage of premium plan over the basic plan is the 5 materials which I have told you, right? So those 5 materials along with soft copy, you guys are going to get physical copy also. In basic plan, we are offering only the soft copy. But in premium plan, along with the soft copy, we are providing the hard copy of the material, the physical copy of the material also. Same ICD-10 CM, ICD-10 PCS book, CPT book, and this anatomy, physiology, and medical terminology book, and the study guide. So all these we are going to offer physical copy also. And in the basic plan, I have told you, like you will be having 6 months access for the study materials, assessments, and the class recordings and all. But here you will be having 1 year access. 1 year access will be the study materials, assessments, and the recorded sessions. So coming to the course fee. Team, we are offering basic plan for 15,000, and after discount it is only 12,000 only. Now we are charging only 12,000, and we are offering 2 installment options also. Like you can pay in 2 installment. First installment 6,000 and the next installment next 6,000 you can pay. Or if you are ready to pay in a single installment, if you are paying, there is at the time, if you are ready to pay in a single time, if you are able to pay means, then we are providing 20% extra discount from this 12,000 also. So from this 12,000 also, you are going to get extra 20% discount if you are ready to pay in a single installment. Next, coming to the premium plan. So as I have already explained the difference between the premium plan and the basic plan, the thing is you are going to get hard copy of the materials also, physical copy also along with the soft copy, and the material access is for 1 year. Whereas in basic plan, it is 6 months. Here you are going to get it for 1 year. So premium plan, the course fee is 20,000, and after discount, it is only 16,000. And here also you can pay in 2 installments, or if you're ready to pay in a single installment, from the 16,000 also, you are going to get 20% discount. So team, coming to our training benefits, we are providing the app access for the study materials. You can take this in the mobile, laptop, desktop, tab, anything you can take. And along with live sessions, we are providing recorded sessions also, which will be very much helpful. Like if you have missed a session or if you're having any doubts in a later date also, again, you can go through that, right? Because if you're attending today, you may feel like it's clear, but after reading only, you will get a doubt. Then you can go through that recorded session. So that will be very much helpful. And apart from that, we are offering this CCS study guide and this assessment questions and all there, right? So all these are frequently asked questions, team. So the questions will get repeated in your CCS exam. So if you're already exposed to such questions in your assessment here means, then you can easily solve them in your CCS exam also. And in our institute, without any restrictions, you can attend both weekdays and weekend, that is weekdays and weekend. If you want to shift now, you can shift. Initially, you have joined for weekdays, but if it's not comfortable now, then you can go with the weekend also. And you can swap from online to offline, offline to online. So these are the advantages. And our trainers are available in Tamil, English, Hindi, and Telugu. So, one more thing I forgot to tell you. So, team, you are going to get 3 days of access to our study materials. Okay. So those who are attending this demo, you guys can get 3 days of access to our study materials and classes. So you can attend these sessions, you can see the recorded sessions, and you can take the assessment. Then you can go through the study materials which we have given for 3 days. So that you can able to know right, like how we are providing these materials and how it is valuable. Na? Then once you have paid the fee, then your access will continue. If you are opting for basic plan, it will be for 6 months, or a premium plan means for 1 year it will be continued. But if you're not paying the fee means, then after 3 days, automatically the app access will get expired. For further queries, you can contact us, team. Thank you, team. Thank you so much for your cooperation. Have a good day.